right, Kaiser, please begin by introducing yourselves and explaining your rate request.
Thank you. Hi, I'm David Liebert, and I'm an actuary with Kaiser Foundation Health Plans in the Northwest, and I'm here with Luke Hampton. Luke will be presenting our small group rate filing first, and then I will present our individual rate filing after that.
Hi, I'm Luke Hampton. I'm here to talk about our small group filing. We have a little over 26,000 members in our small group block of business. We are requesting an average 8.8% rate increase with a min rate increase of 2.9 and a maximum rate increase of 13.4%. The primary drivers of the requested rate increase is change in medical cost and changes in our risk adjustment transfer payments. There are no rating factor changes for 2024, and we are not making any changes to our geographic service area in 2024 either. Now, for plan modifications, new for 2024 is KP at Home. It is a program that allows members to receive select procedures in the comfort of their own home that were previously performed in an inpatient setting. A similar program has been around since 2020 via an emergency order. Also new for 2024, the first 3 office visits have a cost share of a $5 copay before deductible for all non-HSA plans. Now, there have been additional cost share changes made to keep up with changes in cost and utilization and also to retain metal tier status. Now, if you go to Exhibit 2 in our rate filing, there's an extensive list of all of the cost shares for each plan. There are no material network changes for 2024. Now, for plan discontinuations and new plans on our small group filing, in previous years, we have offered 4 versions of all of our non-standard plans. We had a base version without any non-EHBs, a version with vision, then a version with massage benefits, and then a version that had vision and massage. So basically, for these plans, all of the EHBs had the same cost share. It's just between the different versions, we had a different non-EHB benefit. In 2024, we are not offering versions of our plans with the massage-only non-EHBs. Groups are being mapped to plans that have a massage and vision. The members that were previously on a massage are being mapped to a plan that has the exact same EHB benefits. The only difference is now instead of massage only, they have massage and vision for non-EHB. Now, Exhibit AM2 on our rate filing has detailed information on our discontinued plans and their mapping, and we are not offering any new plans for 2024. Now I turn it over to David for the individual filing.
Does the division wish to address the small group filing first, or should I present the individual filing?
Go ahead and present individual, and we'll address them both at the same time.
Okay, thank you, Michael. So for the individual filing, we had approximately 37,000 members as of February 2023. Our average rate increase is 7.88% with a minimum of 3.9 and a maximum of 10.2. And our primary driver of the rate increase is the change in medical costs and change in risk adjustment. We do have area factor changes for 2024. As you can see here, areas 1, 5, and 6 are going to remain at 1.0, whereas area 2 will increase from a 1.05 to 1.085, and area 3 from 1.0 to 1.035. And there are no changes in the geographic service area for 2024. Plan modifications, much like the small group market, we're introducing or formalizing the KP at Home program for 2024, which allows members to receive select procedures in the comfort of their own home when they were previously performed in an inpatient setting. And this program, as Luke had mentioned, is similar to a program that we have been offering since 2020 as under an emergency order from CMS. We do have for the Oregon standard plans and 2 of our Kaiser specific plans, we are offering the $5 office visits for the first 3 visits prior to the deductible. There are additional cost share changes to other plans that we've made to keep in line with the metal tier status or to adjust for changes in cost and utilization, and those can be seen in Exhibit 2 in the rate filing. There are no discontinued plans for 2024, no new plans, and we have 16 renewing plans, and we are not making any material network changes for 2024. And that's the end of our presentation.
Thank you. Division staff will now lead a discussion about the division's review of the filings and preliminary decisions.
Thank you, Ethan. My name is Michael Sink, primary senior life and health actuary for the division and primary reviewer of these filings. I'll pause for a moment while other division staff introduce themselves.
My name is Tasha Sizemore. I'm the Life and Health Program Manager.
TK Keene, Administrator.
I'm Kristen Anderson, Deputy Administrator for DFR.
All right, thanks, guys. So I will present our findings and this rate review in the order that they presented them. They did small group first, which is great because it gets into a topic dear to me, which is the status of the small group filing for 4th quarter of 2023. Those following the rates in the Kaiser small group rates will know that they've proposed a rate increase in the 4th quarter in October of 2023 that already gave us indication that rates were going to come up in small group, and that was continued through into 2024. At the time, we noticed that Kaiser made a statement that we were going to anticipate that Kaiser would spend more time with their trend development for 2024, and they did exactly that. And so I want to thank you guys for going through that effort, putting that together for us, so that we could not only see what's behind the rate trends that Kaiser has put together for us, but also even up the expectations across carriers, because other carriers had been doing this for a while. So we appreciate that. We do understand that Kaiser is has higher medical management than the other carrier or the other insurers, and as such have consistently had lower trends in the marketplace. That continues to be true even with this restatement. However, trends have come up, and that is the part of the source of the rate increase you are going to see today. So let me back up. There are 3 main components that we review on a filing. We make sure that the data is appropriate, the assumptions are reasonable and not excessive, and then the calculations at the end of the day are accurate and up to actuarial standards practice. And small group depends a lot. Their 8.8% rate request depends a lot on that experience. And as we saw in October of 2023 rates, that data was showing the claims were going up. That's the historical starting spot. So if the historical claims are coming up, that is going to be the basis 3 months later for the 2024 rates. And we did see a similar request 3 months later in the 2024 rates. Now their trend, they reanalyze. Anybody who's been following the Kaiser filings, I encourage them to go out and take a look at all of the new information provided by Kaiser. Their trend.
So Michael, if you could just repeat everything you said in the last 2 minutes, that would be, no, I'm joking.
How about I start at the individual filing? I didn't get too far into individual filing. I could start there.
Sure, that works.
Okay, great. So starting over on the Kaiser individual rate filing review for technical issues. The Kaiser individual filing is different than the small group filing in that it has been a full year since we have seen the experience, and so the full restatement of 12 months instead of just 3. But I want to point out that the trend has been restated on the individual side up to 5%, and in last year I believe it was 3%. So that difference, if you include the 2% from 2022 to 2023 and the full 5% from 2023 to 2024, 7% of the rate request of the 7.9% total rate request is strictly due to the restatement of trend. Again, we believe this is a better development of trend that we have seen from Kaiser, and we approve them doing this. Then individual, though, does have all of these other elements. A lot of change has been happening in the marketplace for 2024. And Kaiser has been a vocal participant in those discussions, things like the basic health plan and the impact of the $5 copays on the standard plans in individual. But at the end of the day, Kaiser has not made additional adjustments to their rates to account for these. Specifically in the basic health plan, they felt that the silver loading, the component of the second lowest cost silver plans and the exchange plans, is the driving factor for any instability that would happen in the marketplace in 2024. And as I stated at the beginning of this hearing this morning, I will restate here, the division completely agrees with that if there is not a strong reason to expect a mass exodus of members in July of 2024 from the individual market, we are creating our own instability by making an adjustment to the silver loading that is otherwise not justified. So we decided that members who are presented with the basic health plan in July of 2024, if they are sick, if they are going to a doctor, if they are already receiving care for the year, they are absolutely not going to be interested in changing their plan mid-year. The best we can determine, the people who are most likely to identify the basic health plan and shift over to it are those who find themselves in a financially qualifying situation, which would send them back to healthcare.gov, and CMS would identify the basic health plan as an option for them. This is effectively the same as people who would drop off the marketplace already, and no additional adjustments would be needed to our factors already include normal visits to CMS and changing your plans. So with that in mind, we agree completely with Kaiser's assessment. We are not anticipating any need for and we are not recommending any adjustments to the silver load for 2024, expecting that most of the people who move to the basic health plan will do so in January 2025. So we will be postponing this discussion then, of course, until 2025 rate filings next year. But it will still be before people actually start moving. So it'll still be a guess. It'll still be a bit of assumptions going into the pricing process, with the exception that people will have a fresh year, a full year to decide whether or not they're going to move to the plans. So we'll have that discussion at that time, but as of now, we are not making adjustments to silver loading. That means there's no disruption to the individual market and no need for additional rate adjustments. Kaiser did not make any changes due to COVID or the diabetic drugs that are being used for weight loss, and specifically mentioned that they have medical management ability to maintain and monitor that usage, which is great to hear, and the result is no impact on the filings. At the end of the day, their initial request is their final request for 7.9% average annual rate increase, and we are recommending approve that as filed.
All right, thank you, Michael. Kaiser, do you have any additional information or comments you'd like to make at this time?
No, we do not have any additional information or comments at this time. Thank you.
Great. The division will consider all information before making final decisions on these filings. We'll now take any public testimony. Please unmute and introduce yourself. All right, it sounds like no one has signed up to testify, so let me remind everyone listening that August 4th, today, is the last day for public comments. They can be submitted through our website, www.oregonhealthrates.org. Thank you, and that concludes today's hearings.